Hello everyone, my name is Khadimatlo. I'm here with my colleague Nala Seale. We are third-year pharmacy students at the University of Western Cape. Welcome to the Black Booth. What we'll be talking about today is the promotion of pharmacy profession through mental health awareness. September is Pharmacy Month, so the theme for this year was mental health awareness. What we did as third-year class was to place gazebos between A and B block in the University of Western Cape Bellville campus, and then we were actually just explaining to people what pharmacy is and what mental health is and how does that incorporate with each other. What is pharmacists' roles in mental health? So we actually have been talking beyond dispensing medicines. So we're actually trying to cancel this thing of saying that pharmacists are medicine experts. Yes, that's true, but we just wanted to highlight also the fact that we can do more than that.
All right, just to add on what she said, on the day, which was the 25th, we had a setup where we interacted with students. We talked to them about pharmacy in general and mental health. Because I remember there was a student who came asking about how to deal with friends that have that go through mental health disorders. And then I had to talk to her, telling her that no, in a sense, we must talk to these people so that they feel home, and we must make sure that they eat proper food, like healthy, have healthy diets, and they exercise. They do all these interventions to make sure that they create a healthy mentality. And joining the two, well, pharmacists basically, they counsel patients, they give out medicines, and they, in a sense, do outreach to the community in order for them to do healthcare awareness to communities. And then now bringing it home to mental health, that's when they would tell patients or the community about how to deal with mental health, how to deal with family members that have mental issues.
How would you say you personally relate to the topic that you had on that day?
Okay, from what I understand about mental health is a person's level of psychological well-being, which is a measure of how a person can function on a normal basis, an absence of a mental illness. So I realized that a lot of people are actually having a hard time focusing on campus usually, like students mostly, they are really having a hard time. So I can say that I have been one of those students. The stress and pharmacy pressure is really a lot, and sometimes you find that you really can't cope, so you have to speak to people. So as a future pharmacist, I feel like this mental health issues are really some things that we really need to have thorough knowledge about. And I have actually had a mutual friend who passed on last year, may her soul rest in peace. I wouldn't say that I knew what was happening with her, so there were a lot of issues that were actually affecting her, but I didn't know because I couldn't actually speak through her. So after they announced this topic of mental health awareness, it really touched me too deep. Like, I want to speak to other people and actually let them know of what's happening, where they can get help, and how they can really help themselves through this. It's a really difficult situation, so it's an emotional issue. Yeah, that's how it gets me, I guess.
All right. Well, the way I relate to it is that, you know, if you think of it as a black person, you growing up weren't exposed to such things. So now when you tell your parents that no, I'm going through depression, I'm going through such a mental illness, it's something that they don't understand. Maybe they will tell you that no, you just need to maybe go play with other kids and do something. It's something that we don't understand, because I had a family member who went through such thing, and then the parents didn't know how to deal with the family member. So now it's something that we might know but don't have thorough knowledge of. Thus we need to make awareness so that people know of it. So now I feel like for me it's something that should be, in a sense, attended to. Like, it shouldn't be a 1 month thing, or it shouldn't be an annual thing, but it should be something that we do on a daily basis, whether it's your friend, it's your family member, is your whatever relationship you have. You talk to your friends, you talk to those people, because a simple thing as a how are you, it doesn't surface, because normally people these days, they don't respond well to how are you. It's just like a song, you sing it, it's something that we were taught. Like if I meet Hadi today, I'm like, Hadi, hey, how are you? It's something that she's taught, or no, I'm gonna say I'm fine, thank you, and how are you? And it doesn't happen that people sit down and be like, Hadi, today how did your day go? Because such a question, it is an example of what could open up a person, be like, no, my day went like this, and this, and I felt this way because of this. So now such small things, they contribute. And even talking to the individual, you don't need to be harsh to them, in a sense, because you need to create a homey kind of feel, so that the person can be able to open up to you. Because sometimes we would say, it's like now telling Hadi, like, Hadi, I'm here, I'm your friend, talk to me, but my attitude doesn't say the same thing. So this is some of the things that we should fix as individuals when we talk to people that go through such mental health issues.
From the spot that we were placed at, we were actually really scared that students don't usually come that side. They usually go to like student center side and the library side. But hey, we were really amazed. A lot of students really pitched to our settings. So what I have realized, there are a lot of students suffering. They are suffering from what they cannot speak out about. Like, they really having serious issues. I spoke to one student. That student told me that she can't sleep, she can't focus, she cannot study, she cannot function normally, which means there is some sort of mental disturbance somewhere. So we actually just had to explain to students what we can offer, because we're just students. So we just offered non-pharmacological interventions, like exercising your sleep pattern. They should maybe initiate a sleeping pattern, how they can do it, and then a healthy diet, and then also to not to be like alone. They must have friends and socialize and be around people and speak about it, even though I know it's not easy to speak to strangers mostly, because sometimes we get friends and then we judge each other. But it was a really effective wellness. A lot of people came, they pulled through. There were games that we were playing, mind-tricking games, just to see if people can really focus and forget about the rest of the things that are bothering them. It was quite good, and we're really impressed. And shout out to you, Dubs. We really thank them for their support. And yeah, we hope that the information that we actually gave out helped a lot of people and touched them. Yeah.
So basically, your whole initiative or your whole project, as pharmacists, you all know that you dispense medicine and all those kind of things, but you try to stray away as much as you can from trying to medicate every issue that came.
Yeah, the main point of this whole presentation was to move away from medicines. We're actually trying to tell people that we can do way better than that. So we usually taught that even when we're giving out medicines, it's not the medicines that we actually want to just give out to people. We need to give people something that they can take home with. So mostly we have something called pharmaceutical care, whereby you initiate a patient therapy, where you tell them about things they can experience while taking that medication. So now, moving away from that medication part, we're actually counseling. We're actually giving people what else we can offer. We can refer them to specialists who can really help them with cognitive therapies, and then other things that are beyond our scope of practice. So what we can just do is just counsel them and help them go through, especially those ones who are at the lesser stages, not diagnosed ones.
Would you say that currently the pharmacists that are working in the industry right now are practicing what Khadi's mentioning, the pharmaceutical care thing?
All right.
Are they practicing it?
It depends, because I feel like we can't compare the whole spectra of pharmacists, because you might find that these people, they practicing based on what they're taught or based on what they see. So I feel like it's a thing that goes from community to community. So now maybe you look at the community that you're in, and you look at maybe the community might go through substance abuse, the community might go through different interventions. So now you do such things based on what the community goes through. But in general, I feel like it should be something that should have been practiced, because as a pharmacist, your number one goal is to give out pharmaceutical care, and not only sing out the song of like, no, take this tablet one tablet twice a day, something like that. No, you actually have to have a conversation with the patient, get them to know about the conditions that they go through. So now, if it's not happening, I challenge the pharmacist to do it, and so that it brings up how patients view us. Because now, in a sense, people look at us as we are retailers who are just giving out medications, of which it's wrong. We are actually there to talk to them and to help each other out, in a sense, so that we make sure that the health system is boosted. So I think that's my answer.
Can I add?
All right.
Oh, okay. What I want to add on what Nala said is that, honestly speaking, I feel like there are really few people who are practicing pharmaceutical care, because you'd walk into a pharmacy and then you find that the pharmacist just want to give you what you want and then you leave, of which is something that we really not happy with, honestly. Like, we're trying as much as we can to be the change agents, to come into this industry and change, because we are the last people in this healthcare system chain. From doctors prescribing to nurses and everyone, we are the last people that patients see. So it's really important of us to really practice pharmaceutical care and even go extra mile for patients. Yeah. Oh yeah, what I can say is that even though we're not there to actually practice pharmaceutical care, we're like doing mostly the counseling part and actually trying to see if people know what pharmacy is and what actually pharmacists do. It helped us. It was really scary, I can tell you. We had first lecture in class and I could see a lot of people struggling to focus because we were really worried about our presentation. So one of the topics that other groups had was like break the ice. So we're actually as well trying to break the ice of like, we're moving away from over the counter to being with people there and trying to engage with them, trying to know how far they know about pharmacists and then what they know we can offer. And yeah, I think it really helped us to open up and try to speak out more than what we actually normally do.
No, just to add on what you said, we had like different interactions with different individuals, and that in a sense, it opened the door of what it would be like in the workplace. Like, because you know, as students, we go through a process where you just read books, but you don't get the practical part of it. So now that exposure gave a sense of what you could experience in the workplace, and the interventions that you as a responsible pharmacist or one of the employees in the pharmacy can do to, in a sense, to get to people, because we don't need to be there just to give out medications, but to be there to create a space where people feel free to come to us for medical interventions. Not only that, but for anything that they'd want to ask us in order for them to be knowledgeable. Okay. The funniest thing is that, you know, let's just say you go to a clinic and you wear your clinical coat. And then a person comes to you, it's like, doctor, please help me. I have a problem here. And then you're like, ma'am, I'm not a doctor, but I would like to help you. Now, their face changed, like, you're not a doctor, but you're wearing a coat. Still, you should have a knowledge of this. I'm like, ma'am, please, I don't want to misdiagnose you. I don't want to do anything to you, understand?
What are the same thing?
Okay, for me, the fun, okay, not that I'm making fun of patients, but yeah, for me, what was like really funny for me is that when patients come and take advantage of you, they see that you knew. They used to other faces in the pharmacy and then they see that you knew. They're like, oh, I didn't get my medication last month. And then you're like, okay, let me see your folder. They bring the folder like, but you got like 2 months supply. No, the thing is my heart started beating faster than normal. I had to take 3. And I'm like, okay, Dimu joke, Dimu lord. Like, what are you saying? Just because of you, you're taking advantage. Like, those are like one of those things.
It can be dangerous, ne?
It is. Because sometimes I feel like I said, like we're the last people on the chain, the healthcare chain. So if we don't tell patients what to do when they experience side effects when they take in medicines, that's what is going to happen. A patient is supposed to take 1 tablet a day, but they end up taking 2 because they feel like, okay, I'm having palpitations or something. So if we don't tell them that, be aware of the side effects, be aware of this, it's actually going to be one of our problems in the healthcare facilities. But yeah, I don't even know if that's funny. But yeah, we don't have jokes like.
Yeah, no, you asked the wrong profession for jokes.
I'm kidding. Shout out to your group mates. Like, yeah.
Okay. Looking back at the day, which was Wednesday, we really did a great job, and my team, which had a theme, mental health, it gets better with the pharmacist. We did a great job, and we'd like to thank everyone who actually posted their thoughts on how they manage their stress, or when they're feeling anxious, how do they cope. There's actually my favorite line posted on the tree. Someone said, "Dear Seale, Dilal." That was a standout for me. But yeah, I'd like to shout out to my group. Thank you so much, and Dr. Parker for actually giving us this opportunity to express ourselves in that manner, and getting to people in campus and letting them know who we are and how we can help them, even for future reference. And yeah, also shout out to my family.
Yeah, no, just to add on what she was saying, we had a poster, in a sense a pamphlet. On the pamphlet, it was like self-care, like showing you how, in a sense, you can deal with emotional self-care, psychological self-care, physical self-care, and so on. So now you just have a read on that, and those are one of the things that we gave out for people to have a read when they're at home. And other than that, yeah, no, it was a lovely day where we got to spend time with people on campus, saw new faces, saw old faces, and got to know people, even though like you are taken out of your shell. But yeah, no, we really appreciate it. And yeah, no, shout out to everyone that knows me. Yeah. Well, the siblings, the parents, all those family members,
One last thing, guys, mental illness is a serious thing. It's not a name, it's what people have, not who they are. Let's break that stigma. Yes, it's not what. And stop saying people are crazy, guys.
Yeah, no, that's true.
Let's not say that. Let's respect each other and love one another.
There we go. Because the worst thing to happen is that, because when somebody is sick, you can see the sickness, but when it's a mental thing, you can't see it. So now it's hard to see it. So now it's something that we must take these people like their eggs, so that
They usually feel it.
Yeah.
You see the mood changes, and then they be away from people. Let's don't say no, mama.
Now you want to take people to Vescopies and all those.
Now we are all doctors. Now we want to diagnose and do.
Yeah, no, we are very thankful.
Thank you, Kila, for this opportunity.
Really.